Now, it was a matter of when COVID-19 will end up at State House. And I've always anticipated a situation where we are going to test positive cases at the State House. If you saw how State House handled COVID-19 when it came, it took care of the citizenry and never took care of themselves. And this is not exclusive to the Kenyan State House alone. We have had heads of states across the continent. We have our neighbors in Uganda joking about the disease. We had Rwanda playing about with the disease.
Nkurunziza reportedly.
Yes. And the former president has fallen a victim, purportedly. We had Boris Johnson joking with the disease and greeting patients at one point, and the next point he was in an ICU bed. We've seen the same cases reported at the White House in America. So it was a matter of when. And it has come at the opportune time. I would say, sorry. But then, I would want to talk about public facilities as a whole. And when I want to address the public facilities in this country, we have a tendency of ignoring our public facilities in this country. And sometime last year, we had a discussion here on our public schools when we had a problem at Dagoretti when a school collapsed.
Yes.
And we talked about how our public schools are failing, and it ended. So it's a case of we need to interrogate everything that is public facility in this country. It needs to begin from health. We need to interrogate our public facilities within the transportation sector. We need to interrogate our public facilities in terms of education. And on narrowing down on the issue of health alone. You know, we have UHC,
yes,
which is interpreted in two meanings in this country. We have UHC, which some interpret as universal health care, some interpret as universal health coverage. The ministry needs to come clean on what they have and what they are talking about. Because when we talk about universal health coverage, it means you are going to build an hospital in my home in Uyoma in Rarieda without equipping it with the right facilities. You are going to build another one in Kwale, another one in Ganze, in Malindi, another one maybe in Northeastern, but without facilities. And without people being able to check into those hospitals and get the right quality services. And that is what we are seeing right now in the country. We have universal health coverage, where we have hospitals in Siaya County, we have hospitals in Makueni, we have hospitals in Lamu, and all the 47 counties. But then ask them, for example, how many isolation beds that they have.
None.
None. So we are addressing a situation where there is a total failure in the healthcare system. And by just the mere fact that we have staff from State House Kenya, which is in Nairobi County, being quarantined or self-isolated at Kenyatta, a facility in Kenyatta, which is in Kiambu County, talks a lot about Nairobi, that we assume to be having all the right facilities. Why to Kiambu County?
The wanting state.
Yet,
of the
we have
healthcare
Nairobi
system.
County.
Which again perhaps begs the question as to what the president did raise when he met the governors last week on Wednesday, that even as the situation appears to be a bit dire at the county level, Nairobi appears to be fully occupied in terms of the bed capacity, and therefore I can't open up because you counties are not prepared enough.